So last week we spoke about what are the different ways that you can prevent foot disease, especially in people with diabetes.
You know, when you have diabetes, you have a higher incidence of having complications of diabetes, like neuropathy, in which there's decreased sensation, and also vascular disease, in which there's decreased blood flow to the part of your body. And this happens a lot to the leg.
And this further can lead to poor healing of either little cuts or wounds that you might get. Since you cannot feel the ground, you end up not even realizing that you might have a cut. And this can further lead to gangrene and in some cases even amputation.
Now, whenever you injure yourself, you require blood, because blood will carry the nutrients and everything else that is required to heal the wound. Now, when you have peripheral vascular disease, this wound may not heal. And data suggests that every 30 seconds, a leg is amputated somewhere in the world because of gangrene and a non-healing ulcer. So today on Doctors on Call, we will talk to you about what is diabetic foot and what are the different things that you can do to prevent it. I'm Dr. Sameer Gupta.
And I'm Dr. Sonia Lal Gupta. And welcome to Doctors on Call.
The overall lifetime incidence of diabetic foot ulcer is 25% in diabetics, and the risk of limb amputation is on an average 20 times more than people with diabetes. Some of the risk factors include uncontrolled blood sugars and poor circulation due to plaque deposition in the arteries of the legs and feet. Research shows that high blood sugars can cause nerve damage, called diabetic neuropathy. The nerve damage is most common in your hands and feet, and usually the legs and feet are affected first. Most common symptoms include numbness, tingling, burning and sharp pain. Over time, this causes loss of coordination and problems with balance. Now, as you cannot feel the ground when your feet are numb, small cuts and sores can go unnoticed. When left untreated, due to poor circulation, these little cuts can become major infections and invade the bones, leading possibly to amputation of limb. Now let us hear what some of the doctors in the community have to say about foot care.
Diabetes can affect the foot in two ways. One is due to nervous system damage and other one is due to block in the blood flow below the knee and leading to chronic non-healing ulcer. Prevention is the best way to save the foot. Some tips to prevent diabetic foot is tight blood glucose control, tight blood pressure control and stop smoking. And inspect the foot regularly, check for any cracks or fissures or any corns or callus and nail problems and any changes in the skin color like black skin or red skin and any pain in the foot. And never walk in barefoot. And proper and modified footwear according to the pressure point. And use moisturizers for dry foot or cracks. If any diabetic foot wound develops, visit your diabetologist or foot surgeon immediately, and they may suggest complete bed rest, foot elevation and daily dressings and appropriate antibiotics.
Foot care means self-management. Daily you have to see the foot. If there are any new changes, immediately you should report to your doctor. The new changes may be any redness, ulcer or blisters. And also wash your foot daily and try to use slippers both at the home and also outside, and properly select your socks and soles. Okay, if you develop ulcer or any foot related problem, what should you do? So first thing is immediately contact your podiatrist or endocrinologist, get your glucose level under control and see whether you require any antibiotic treatment or debridement. So if it is a small ulcer, the doctor will treat you with antibiotics, and if required, maybe debridement. And if your ulcer is deep and long-standing, you may require more intensive surgery, and also you may require admission. And nowadays, more sophisticated treatments are also available, like hyperbaric oxygens, many growth factors which can be applied to have faster healings, etc.
So last week we talked about what are some of the precautions that you can take to reduce your risk of having foot ulcers. The most important being a regular foot exam and controlling your diabetes.
And as we always say, a healthy diet, regular exercise and quitting smoking all go a long way in managing your diabetes and avoiding complications.
That's all for now. See you next week.